You're watching Let's Chat.
At the beginning of the show, we told you we had some important information to share from the Hamilton County Health Department, and this is Men's Health Month. Dr. Stephen Miller is here joining us. Dr. Miller, good to see you as always. Men's Health Month. Tell me how you folks at the Hamilton County Health Department are chiming in on this to help raise awareness.
Men have a great number of issues that beset them every day in this country.
Do these issues have anything to do with women? No, just kidding. Just kidding. Go ahead. We do have,
but that's another. That's another.
That's
interview.
A whole show by itself. Men do have a rather unique set of health-related issues.
We do. We're built differently, and we exist differently in the country. We're 2/3 more likely to develop skin cancer. From lung infections, men are actually 2/3 more likely to die in the hospital from it, from such factors as smoking and things like that as well. We always think, when we think men's issues, we just think of prostate cancer, which is very important to start screening after age 50 and start talking with your provider about that. But there are many other things that beset us. We're much more prone to infections such as HIV. We're also much more prone to things like COPD and lung issues. The list goes on. And I tell you, as a modern man, both of us, we need to be aware and we need to take care of ourselves.
And you have just touched on the physical issues that men are dealing with. That's to say nothing of the emotional and mental issues.
We're
also
much more likely to, unfortunately, commit suicide. And then a thing I like to call are stupid human tricks. Men are, especially young men, are much more likely to engage in dangerous hobbies and activities that, unfortunately, as you well know, we'll hear of drownings and deaths in the valley that could easily have been averted. One
thing you didn't mention when you were quoting the statistics and percentages a moment ago, and I know this for a fact, men are a whole heck of a lot less to go to their primary care doctors when something's a little out of whack.
I tell you that years of my practice, probably each day, 60% would be female, 40% or far less than that would be men visits.
Why do you think that is?
I think we have a lot of machismo. I think that we feel that we won't take time out of our work day to take care of us. We feel that we need to take care of the family and we always put them first. We don't put ourselves first sometimes.
How do we begin to change that mindset among men? And yeah, we're talking to you.
It does. It crosses every single culture. We need to be mindful because we have to take care of our family and ourselves for the long haul, not just our children, but in this day and age, our grandchildren and sometimes our great-grandchildren. And to be able to run, it's not a race, it's a marathon. We have to be able to take care of ourselves.
Very well said. Tell me some of the primary health services that you folks are offering at the Hamilton County Health Department to get men in, not just when they're, let's say 103-degree temperature and about to drop on the floor. This is on a more continuing basis to make sure once you're in good health, you stay in good health.
You know, at our main services, we obviously offer the necessary immunizations. At our primary clinics, we have conversations with men about when it's appropriate to start engaging in colon cancer screening and prostate screening. We do body checks, skin checks at these clinics as well to try to prevent that, well, much more likelihood of skin cancers. So we try to be as much about everybody, the entire family, but this month we're trying to be extra mindful about our men.
Oh, it's just a little growth on my arm. It's no big deal. How many times have you seen that lead to a horrible diagnosis?
And it'll be a truck driver, and I'll say, you can't leave this office till I take that off and send it in for biopsy. And you and I both know it always comes back skin cancer. So.
Always comes back skin cancer. And there are so many other things that collectively, as men, we do to ignore our health.
We do.
And that's part of what Dr. Miller is here to talk about, to try to overturn that cycle. Because, you know, one of the worst things about that is when the man gets home and tells his wife that, he always hears those little words, "I told you so."
It's true.
So for no other reason to avoid hearing that, make sure you get yourself checked, top to bottom, side to side, inside and out.
Thank you.
You were talking about prostate cancer screening. When should men start that?
Around age 50, and certainly by age 55, you need to be talking that over with your provider or doctor. If you have a first-degree relative, like a father that's had prostate cancer, you need to start those conversations much more early, sometimes age 40. So.
There was a lot of misinformation when the diagnosis of former President Biden and his prostate cancer came out, that once you hit a certain age, you don't need to do that anymore. True or false?
There is a lot of controversy on that, but I will tell you from my personal experience, these are conversations you always need to happen. Now, let the patient make the decision in the end, but at least they deserve that information given to them, and let them and their family and their wife or whoever make that decision for themselves.
And the PSA test is quick and easy.
You're already drawing blood for your cholesterol and everything else that needs to be looked at as well.
How often do we need to examine our cholesterol once we get to, let's say, age 50 or up?
I would do that yearly. That can change with your lifestyle choices and job stress and food choices. So that's a yearly thing. It really is.
What's the biggest piece of dietary advice you, Dr. Miller, give your patients?
Try to take your food to work. Try to avoid eating out. Eating out should be more of a gift or a present to yourself maybe once a week, but it should not be an everyday thing. You really need whatever food you're going to bring from home is going to be nutritionally better than what you're going to pick up out.
Sounds good. Dr. Miller, we're going to leave it there.
Oh,
Thanks so much.
Thank you very much.
And again, it is Men's Health Awareness Month, and even though the calendar will eventually flip over to July, continue this, guys. Get your health checked. Find out more. Check out the Hamilton County Health Department, health.hamiltontn.org.